Okay, chapter 53 is the last chapter that's actually on this quiz. Chapter 54 we covered on a different quiz, and chapter 55, even though it's assigned this week, there are not any questions from chapter 55 on the quiz. So here we go. You can read through chapter 53, the beginning, the definition of vitamins, which ones are water soluble, which ones are fat soluble. A, D, E, and K you should know are fat soluble, which means that the body's actually able to store some of these, which means that you could become toxic in A, D, E, and K. The other non-soluble vitamins like C and B, you have to have every single day in your diet. Okay, so quickly, vitamin A is retinol. It comes from things like animal fats, eggs, meat, liver, fish, and liver oils, and then carotenes, like your yellow, green, and green and yellow vegetables and yellow fruits. Wow, I can't talk. So it's essential for night vision and normal vision, right? And then bones and teeth. And then things like it's used for reproduction and cellular repair. It should be given as a dietary supplement to infants and pregnant and nursing women. If people are deficient in it, you might notice some hyperkeratosis of the skin or night blindness, like acne, psoriasis, keratosis, and I don't even know how to say this, isotretinoin is a skin condition. If the person becomes toxic, they're irritable, drowsy, vertigo, delirium, vomiting, other symptoms. You can get increased intracranial pressure in infants, and then generalized peeling of the skin and erythema over several weeks. It would be unlikely to become toxic in vitamin A. Vitamin D is the sunshine vitamin. It's responsible for the proper utilization of calcium and phosphorus in the body. There's D2 and D3 that we're primarily concerned with. D2 is plant-derived, and so it's obtained through dietary sources, and D3 is more of like our skin and sun derived. Okay, so dietary sources for D2 would be fish oils, salmon, sardines, herring, fortified milk, bread, cereals, animal livers, tuna, fish, eggs, and butter. And then skin sources would be ultraviolet radiation. So it regulates the absorption of and then the utilization of calcium and phosphorus, so it works with the parathyroid hormone and the liver. So vitamin D is essential for normal calcification or hardening of your bone in your teeth. So if we're deficient in it, then we get soft bones, like rickets, and we can get tetany and osteomalacia. And if we have too much of it, well, we'll go to that in a second. So prevention of osteoporosis we use it for, and then treatment of other problems. So long-term ingestion of excessive amounts causes toxicity. So hypertension, weakness, fatigue, headache, anorexia, dry mouth, metallic taste in the mouth, nausea, vomiting, abdominal cramps, ataxia, bone pain because of increased remodeling, and then it can progress to impairment of kidney function and actually osteoporosis if left untreated if you're toxic. So there's some different preps that are available out there, and depending on what you have, the doctor will prescribe different things for you. The Ergo calciferol, I think, is the one that I see the most that people are on. Vitamin E is an antioxidant, and there's 4 different forms. It's available in a variety of dietary sources, animal sources. They don't know exactly how it works, but it seems to help decrease oxidation. Okay, we do not use high-dose vitamin E to treat things like heart disease or stroke or to prevent them. It actually can be harmful. It's not helpful. And then, for the most part, you want to use it to treat deficiencies. It's also used topically for things like scars and skin issues. There's really very few adverse effects. They're mostly GI or CNS. Vitamin K then is also fat soluble. So we had A, D, E, and now K. And vitamin K, there's a couple different types, but the body doesn't store it, which is probably pretty good because, then we just clot and die. So vitamin K1 we get from dietary sources. K2 is actually synthesized in the intestines, which is kind of cool. And so the vitamin K then in the liver where it's stored helps create clotting factors 2, 7, 9, and 10. And that's important because drugs like warfarin work on 2, 7, 9, and 10. So we give this prophylactically to newborn infants, correct? You guys know that, like right when they're born, they get vitamin K shots at birth because the newborn intestinal flora has not had time yet to build up vitamin K, K2, right? Here's another thing that's really important. I don't know if you guys know this. If you give someone vitamin K, their Coumadin at home won't work for a week. So for 1 week after a vitamin K administration, they're really high risk for clots. So it's the reversal agent for Coumadin or warfarin, and for an entire week after receiving the shot, their Coumadin or warfarin at home won't work. Okay. So vitamin K1 and K3 are available, and K2, remember, is made within the body. Then the B vitamins and the vitamin C are water soluble. That means that they dissolve in water and they're excreted in the urine. They're not stored in the body. So it's very hard to overdose on them, which is good. B1 is thiamine, right? Thiamine is related to like the normal metabolism of glucose and the use of glucose within the brain. So problems with B1 include things like Wernicke's encephalopathy and beriberi disease. So beriberi is where you get lesions in your brain and neuropathy of the peripheral nerves. Wernicke's encephalopathy is also known as cerebral beriberi, and that's related to, usually related to alcoholism. That's where we see it the most. Causes of deficiencies usually are diet related, and then alcoholism because of a poor diet, and then malabsorption. Those are the big ones that you'll see. It's essential, again, for the glucose or the carbohydrate metabolism and Krebs cycle. Remember, making ATP. It maintains the peripheral nervous system, the cardiovascular system, and the GI tract. And if the person develops like beriberi, Wernicke's encephalopathy, peripheral neuritis, and pellagra, or neuritis of pregnancy, then we have to treat them. Pellagra, just so you know, is a niacin deficiency. I don't think I mentioned that. B2 is riboflavin, and this comes from foods usually. So vegetables, green leafy vegetables, eggs, dairy, nuts, legumes, meats, liver, yeasts. B2 also is, the deficiency is usually caused by alcoholism, problems with absorption, liver disease, malignancy. And one of the problems when you're deficient in B2 is that you can't activate B6, and B6 is really important for things like our nerves. B2 converts tryptophan into niacin, which is also really important. It maintains the health of our red blood cells, and it's needed for normal respiratory function. So B2 is pretty serious as far as why we need it. So it's interesting though, what happens to us if we're deficient in it is you get these chelated lesions like chapped and fissured lips, seborrheic dermatitis, and keratitis of the eyes, to the cornea. So indications to give it would be dietary supplementation, treatment for deficiency, if the person has microcytic anemia, if they have severe acne, migraine headaches, or other uses, B2 is pretty effective. There really aren't any adverse effects, but just know that the B vitamins like to turn your urine yellow to orange. So basically what happens is you take vitamins in excess of what you actually need, your body absorbs what you need, and what you don't need, it urinates out. B3 is niacin, okay, and that's found in usually enriched, we enrich our breads and cereals with niacin, but also beans, turkey, tuna, liver, yeast, and that's also synthesized from tryptophan, which is an amino acid. And so basically this works to do glycogenolysis, which is the breaking down of the glycogen in the liver, and internal or cellular respiration. And then it also helps with metabolism of lipids, proteins, and purines, which is another amino acid. So niacin, which is B3, prevents pellagra. And it also can be used as an anti-hyperlipidemic drug. So it lowers your serum cholesterol and triglyceride levels. But it's interesting because you have to take so much of it that a lot of times people get flushing. So in higher doses, they get niacin flushing. Niaspan, which was the drug that really caused that, is no longer on the market in the United States. So people can just take niacin tabs, and some people tolerate it better than others. Here's just an example of niacin, the conversion, how it ends up where it is. So this is the pellagra, the niacin deficiency, and what happens to you in the body. And it's unpleasant when suggested. Effects are seen, adverse effects of the drug are seen if people get high doses, and as I said, flushing being the big one. Some people also go itchy or get some GI upset. You have a patient who's taking isoniazid for tuberculosis. The nurse anticipates supplementation with which vitamin to prevent drug-induced neuritis? Dun, dun, dun. All right, so vitamin B6 is pyridoxine. And this is used because it's amazingly good at protecting the peripheral nerves, the skin, and the mucous membranes in the body. So you can find this in a lot of foods. It has pyridoxine, pyridoxal, and pyridoxamine in it. So protein, lipid, and carbohydrate utilization, and then conversion of tryptophan to niacin, it helps with that as well. And then it maintains the integrity of your nerves, your skin, your mucous membranes, and your blood system. If you're deficient, you can have all of these problems. None of these are great. Reasons that we would supplement: so you don't have enough, you're not absorbing it well, you have alcoholism, cirrhosis, hyperthyroidism, and then drug induced. So you're taking the isoniazid for your, Hep C or your TB or whatever, taking hydralazine or whatever. But those will cause B6 deficiencies. So you want to prevent and treat the deficiency. Interestingly, if you have somebody who's having seizures that are unresponsive to their usual therapy, morning sickness during pregnancy, or some of our other just random metabolic disorders, sometimes dosing them with B6 helps stabilize the cell membranes and stop those. You can get neurotoxic, though, with high doses of B6, so people need to be careful. What's interesting is you can give it to your Parkinson's patients if they're taking carbidopa-levodopa, but if they're taking just levodopa alone, they can't have it because it can get toxic. It reduces the effect of the levodopa. It's interesting. B12 is cyanocobalamin. Cyan meaning blue. It has blue in it. Also water soluble. All the B vitamins are. Usually synthesized in the body, unless we're B12 deficient, right? Get it from food sources. So it helps with fat and carbohydrate metabolism, protein synthesis, growth and cell replication, hematopoiesis, which is the creation of blood cell components, and nucleoprotein and myelin synthesis, all good things. So when it enters the body, this is how it breaks down and where it goes and what it does. Pernicious anemia. Remember we talked about if the person is lacking intrinsic factor, they have pernicious anemia because they won't absorb B12, and that can lead to neurological damage and megaloblastic anemia, so they have big cells. Deficiency states then can be caused by malabsorption or poor dietary intake for people who aren't taking in meat, because really there's not a lot of B12 in vegetables. Oral B12, which is extrinsic factor, requires the presence of intrinsic factor. So you can't just give somebody an oral vitamin B12 pill unless they have intrinsic factor to absorb it. Intrinsic factor is a glycoprotein that's secreted from, again, those gastric parietal cells, right? So those parietal cells have to be functioning. So we have our extrinsic factor, so from the diet or the pill, your gastric intrinsic factor from your parietal cells, they mix together in your stomach, churn, and then get absorbed into the body. Which vitamin does the nurse expect to be ordered for a patient diagnosed with Wernicke's encephalopathy? Thiamine, pyroxidine, folic acid, or cyanocobalamin? So vitamin C is water soluble as well. Comes mostly from fruits and veggies, but also in liver. Can also be synthesized in the body. It does have some oxidation reduction reaction properties, and it helps with collagen synthesis, connective tissue repair, maintenance of bone, teeth, and capillaries, folic acid metabolism, and erythropoiesis, which is the making of new red blood cells. It also enhances the absorption of iron, which is why we take vitamin C at the same time as iron. and we need it in order to synthesize lipids, proteins, and steroids. Cellular respiration, so exchange of gases at the cellular level, and resistance to infection, so it's helpful for our immune system as well. Scurvy is what you get when you are deficient in vitamin C. Rickets is what you get when you're deficient in vitamin D. And that looks like gingivitis, loss of teeth, bleeding in the gums, anemia, subcutaneous hemorrhages, lesions of the bone, and delayed healing of soft tissues and bones. So basically your immune system and your hemopoietic system are shot. So indications would be somebody wants to supplement their diet, they have scurvy, or you want to prevent or treat it. To acidify the urine for somebody who needs that for frequent UTIs or stones. You can't tout the benefit of it to cure the common cold or to prophylactically prevent the common cold, because there hasn't been any scientific evidence that shows that it does. So megadoses of ascorbic acid people used to use to try to actually to do a couple things. So some people used to do megadoses of vitamin C to try to improve their health. There have been documented cases of people using megadoses of vitamin C to try to induce abortion. It's not recommended, obviously. It causes nausea, vomiting, headache, abdominal cramps. It changes the acidity of the urine, but it can also cause stones. And then if you take mega doses of vitamin C for a period of time, when you stop, the body's used to that, and now you can have like almost like a pseudo scurvy like issue. Which vitamin would you take to prevent and treat alterations in your vision? Which vitamin was it that you needed for vision? All right, so vitamin C is great for wound healing, as we said, and now we'll move into some of the minerals. So these are inorganic elements or salts, and they help regulate body functions. Right, we have positively and negatively charged cations and anions. The metallic ones are positively charged, and the non-metallic ones are negatively charged. So calcium is the most abundant mineral in the body, obviously, because it's in our bones. It's 2% of body weight, highest concentration in bones and teeth, and it requires vitamin D for absorption. We talked about food sources. You can read through this. This is not all that important. So it can cause, when it's deficient, infantile rickets, osteomalacia, osteoporosis. You get a calcium deficiency if you have too little calcium or too little vitamin D. If there's a problem with your parathyroids, or if they're missing, if you have malabsorption syndrome. Okay, you would give calcium for all of these issues. And these. And then toxicity can occur if you give too much of it. So just remember that severe hypercalcemia, so too much calcium in the blood, causes cardiac irregularities, delirium, and coma, right? So calcium causes cardiac, confusion, and coma, the 3 C's. And constipation, we could add a 4th C in there. Calcium salts chelate, so they form like a kind of a chalky binding substance to tetracyclines, so we never take our tetracyclines with milk, otherwise they produce deposits on the bones. And if the person is hypercalcemic and you give them DIG, it could kill them. So we don't do that. MAG is required for both nerves and muscles, and it also helps with energy metabolism. It's found in a lot of foods. It's low, especially in alcoholics, but if you have problems with absorption, if they're on diuretics or if they have different metabolic disorders. And you can treat MAG deficiencies with all of these, or why we would treat them, I guess. Treatment of magnesium. So they might be used for constipation, cardiac dysrhythmias, nephropathy. It is a tocolytic, so it stops labor. It also stops the seizures of eclampsia and prevents them in preeclampsia. And if the person is MAG deficient, then we could use it as an anticonvulsant. If they get too much, then remember they turn into this like wet little dish rag. They lose deep tendons. It's hard for them to go to the bathroom. They get CNS depression. They can have respiratory distress. They can go into heart block, hypothermia. And it's a smooth muscle relaxant also, so they actually can have like blown pupils. The pupils dilate. Phosphorus is found easily in foods, lots and lots of foods. It's rare to be deficient. It would be somebody more with like a malabsorption or eating disorder. It's absolutely required to make any sort of energy within the body. And it's important, obviously, because phosphorus and calcium, play an important part in the skeletal system and teeth. So for bones, and you would give somebody phosphorus if they were deficient in it, or just as a dietary supplement. It can cause GI upset. It's a big one. Zinc is important to your body, especially to your immune system. Okay, it's found in a lot of different foods that are good for you. The nurse identifies which food is high in zinc. So dark green and leafy, yeast, peas, or oysters. So what do we do with our patients when we are taking care of them and we think that they have a vitamin or mineral deficiency? Assess the nutritional status, baseline lab values, because you always want to know where you're starting from, history and medication history, and look for any contraindications. So you're providing education about the use of vitamins and minerals at a community health center. One of the participants who's a vegetarian asks if he is at risk for any deficiencies. The nurse identifies which deficiency of which substance as the most common nutritional deficiency in vegetarians. Do you remember which one does not come from plant sources? Which one do you have to get from, really need meat sources to get? So follow your specific guidelines for administration, provide nutritional counseling about necessary foods to include in the diet, monitor for therapeutic responses, right? Monitor for adverse effects. Which substance does the nurse identify as useful in the treatment of hyperlipidemia? Which one of these could we use to treat the patient who has elevated cholesterol levels? All right, that's it. Enjoy. I'll leave the quiz open for a week. So it's Wednesday night. I'll leave it open actually for a week from Thursday.